Understanding vertigo causes, diagnosis, and treatment. Today, we're talking about vertigo, a condition that can make you feel like the world is spinning. If you've ever felt dizzy or off balance, this video is for you. We'll discuss what causes vertigo, how it's diagnosed, who is most likely to experience it, and the best treatment options available. Let's get started. What is vertigo? Vertigo isn't just dizziness. It's the sensation that you or your surroundings are moving when they're actually still. It can range from mild episodes to severe attacks that make it hard to stand or even move. 1. A false sense of movement or spinning. 2. Loss of balance. 3. Nausea or vomiting, sweating, and abnormal eye movements. Now, let's break down the different types of vertigo and what causes them. What causes vertigo? Vertigo is usually linked to problems in the inner ear, which controls balance. Here are some common causes. Benign paroxysmal positional vertigo, BPPV. The most common cause. BPPV happens when tiny calcium particles in the inner ear become dislodged, sending false signals to the brain. Meniere's disease. A disorder of the inner ear causing fluid buildup, leading to vertigo, tinnitus, and hearing loss. Vestibular neuritis or labyrinthitis. Inner ear infections that inflame nerves responsible for balance. Migraines. Some people experience vertigo as part of migraine attacks. Head injuries. Concussions or trauma can damage the inner ear and affect balance. Stroke or neurological conditions. While rare, vertigo can sometimes be a sign of a more serious underlying issue. If you're experiencing frequent episodes of vertigo, it's important to see a doctor to determine the underlying cause. How is vertigo diagnosed? If you have persistent vertigo, a doctor can help determine what's causing it. Diagnosis typically involves a physical exam and specialized tests. Here are some common methods. Medical history review. Your doctor will ask about symptoms, how often they occur, and any triggers. Dix-Hallpike maneuver. A physical test where a doctor moves your head to see if it triggers vertigo symptoms. Balance and coordination tests. To check how well your brain and body process balance signals. Hearing tests. To rule out conditions like Meniere's disease. MRI or CT scans. In rare cases, imaging may be needed to check for neurological issues. Getting the right diagnosis is key to finding the best treatment plan. Who is most likely to get vertigo? Vertigo can affect anyone, but some people are more at risk. Here are the groups most commonly affected. Older adults. Balance issues become more common with age. Women. Studies suggest women experience vertigo more frequently than men. People with inner ear conditions. Those with a history of ear infections or Meniere's disease are at higher risk. Migraine sufferers. Those with frequent migraines may experience vestibular migraines, causing vertigo. Individuals with head trauma. Concussions or injuries can lead to long-term balance issues. If you fall into one of these categories, you may want to take extra precautions to manage vertigo symptoms. How to treat vertigo? The good news? There are effective treatments for vertigo. Treatment depends on the cause, but here are the most common approaches. Canalith repositioning maneuvers. Exercises like the Epley maneuver can help reposition inner ear crystals causing BPPV. Medication. Antihistamines, anti-nausea drugs, or even migraine medications can help. Physical therapy. Vestibular rehabilitation therapy, VRT, strengthens your balance system. Lifestyle changes. Reducing salt for Meniere's disease, avoiding sudden movements, and staying hydrated can help. Surgery. In rare cases, surgery may be needed if vertigo is caused by an underlying structural issue. For those with chronic vertigo, a combination of therapies may be the best approach. Can you prevent vertigo? While not all types of vertigo can be prevented, you can take steps to reduce your risk. Stay hydrated. Dehydration can trigger dizziness. Manage stress. Anxiety can worsen vertigo symptoms. Avoid sudden movements. Quick head movements can trigger vertigo. Sleep well. Poor sleep can affect your balance system. Regular exercise. Strengthening your balance through yoga or Tai Chi can help. Making these simple lifestyle changes can go a long way in keeping vertigo under control. Final thoughts and takeaways. Vertigo can be frustrating, but understanding what causes it and how to manage it can make a huge difference. Whether it's a one-time episode or a chronic condition, there are ways to treat and even prevent vertigo from taking over your life. If you found this video helpful, give it a thumbs up, share it with someone who might need it, and don't forget to subscribe for more health and wellness content. Have questions? Drop them in the comments. I'd love to help. Thanks for watching, and stay balanced.